So, Christine, what we were really interested in is this Dementia Diagnosis Toolkit, and you have clearly had much experience with running the toolkit itself.
Mm-hmm.
Can you just tell me a bit about the main things that you found when you ran this project?
The main things for me were obviously coming from a clinical background. I didn't have a lot of experience in setting up a project, so that was really important to give rigour to the toolkit and have consent and information governance for it. And then actually using the toolkit was very, very straightforward. It was very, very self-explanatory. It wasn't difficult to use at all. It was received well everywhere that I went, and I went to a number of care homes, over 20 I think. It was an assessment that was easily understood by any of the staff that were present when I made an assessment, and the feedback from care homes was that they'd found the whole process very useful. We didn't have feedback from every care home, but the ones who did give us the feedback, it was very, very positive, and I think the family's feedback was also positive. So the toolkit assessment itself, I thought, was very, very straightforward and very easy to use, and kind of demystified how you make an assessment for somebody who may have a cognitive impairment.
And what do you think were the main findings of actually using it in terms of the study itself?
Surprisingly, there was a fair proportion of people who had a diagnosis of dementia that the care homes didn't know about. But care home managers and care home staff were very, very good at knowing who needed an assessment. And I think from their point of view, what was very important was that the people who normally wouldn't have reached a level of needing to be referred to an OPMH team were actually able to be assessed and received input from the GP. And the outcomes weren't always that somebody had a dementia. Some people didn't have a dementia, some people were going to be treated for low mood. And I think the toolkit lended itself to very much GPs being in control of the outcome decisions, and a lot of GPs got very involved, and I thought surprisingly a fair number actually diagnosed using the information from the toolkit. I thought it was very successful in that respect.
Yes, it was quite gratifying, really, wasn't it?
Yes.
From the perspective that we wanted to see if we could shift the range of people that would be able to make a diagnosis
Yes.
out of secondary care to primary care. And I think about half of the people that had the assessment in the end, once we'd taken out those that already had the diagnosis, but about half of the people, GPs were able to make that diagnosis in about 9 minutes.
Yes, on average it took about 9 minutes. I mean, some were a little bit longer, some were obviously a little bit shorter, but it fitted very, very nicely into the average time that a GP would give for an appointment, really.
And did you find that there was much resistance to this process? Did you have to overcome any particular barriers to get into the GPs or to work the process to be successful?
I think initially trying to talk about the project in its entirety to a busy care home manager proved extremely difficult. But once we came up with the 4-question questionnaire, things really changed, because those questions really made it very clear to both myself and the person I was talking to, if there was anybody in their care home they had concerns about, that they would like to know more information about the toolkit assessment to see if it was something that was appropriate for their resident and whether their family supported that process.
So this was a questionnaire that you developed, which was a phone questionnaire,
yes.
where you just rang the care home manager and asked them a couple of simple questions about how many people they thought might be in their care